strangers in unusual clothes, tears, needles. This is the world of healthcare through the eyes of your child.
A hospital can be intimidating to anybody, so you can imagine that for a child, a hospital stay can be very stressful. And that's why many healthcare organizations now have specialists to help children cope.
I want to stay down. You can stay here for a few more minutes and then you go to another room. One of my goals as a child life specialist is to relieve their anxieties, any fears or anxieties that they have. So when they arrive at the hospital, then I'll assess the children and talk to the parents, talk to the child, and determine, okay, how can I help this child to be less anxious about their procedure. Do you have a puppy at home?
I do.
You do?
Having the child life specialist on hand has made this hospital visit much easier for Greg and Laura Hines and their 6-year-old daughter, Alexa.
Wow.
Today, Alexa is having her tonsils taken out, but her parents recall a very different trip the last time she had surgery, in a setting that wasn't as child-oriented.
She did a lot of crying and wanting to go home, begging to go home, versus this time she was happy to be here and ready to go.
Creating a kid-friendly environment also plays a big part in putting the child at ease.
I think it was quite a bit easier for her because she did see the other kids playing and she did see them having a little bit of fun, and so it keeps her mind off it. It makes her not think about things that she may not want to be thinking about right now.
The hands-on approach is another tool the child life specialist uses to lower the young one's stress level.
Anything that they can see and touch and they can be involved in helps. That's the best way to prepare a child. The first thing we do after they check in, they'll come back here and I'll show them the pictures, show them, okay, after this, the nurse will take you back and see how tall you are. So I go through the book, you know, as detailed as possible, exactly what will happen. Do you know what the sleepy doctor's called? An anesthesiologist. That's a big word, isn't it?
I think I've heard of that.
Have you heard of that word before?
And with so many people making so many decisions, there's one thing that grown-ups often forget.
There's so many things that children don't have control over when they come to the hospital, and as many choices as you can give a child, the better it is for the child. And you'll have probably either a blue or a green gown. What color do you think you would like?
Green.
A green gown? Okay, we'll find a green gown for you.
Even the trip upstairs to surgery can be a fun ride.
Here we go. I think that it's so important for children to be involved. If they're not, that's when the negative experiences come in. The greatest fear of the child in the hospital is fear of the unknown, separating from their parents. But I'll let them know, your parents will be in this room. You'll just go right around the corner with one of the nurses.
Come here. I love you.
I see you. Okay.
While planning every aspect of a hospital visit, healthcare workers like Laura keep one thing in mind: see things from the child's point of view. For parents, that's what makes the child life specialist so special.
We don't have to worry about coming up with the answers. We just hug her and kiss her and play with her and make her happy, and it's nice not having to worry about the serious side of it until the end. It's less stressful.
With the child life specialist on the home team, mom and dad can concentrate on just being mom and dad.
My baby.
For Smart Medicine, I'm Lorraine Cachola.